Hello, everyone. I'm Dr. Marty Ross, and this is another Conversations with Marty Ross MD tonight. I am speaking to you from my new clinic space. It may sound a little cavernous in here because I'm still putting it together and I don't have any artwork on the walls. I'm even missing my treatment table yet, but we're getting set to start seeing people here at Marty Ross MD Healing Arts in Seattle, Washington on South Lake Union. Somewhere around November 24th is when we've got our first people scheduled here for in-office visits. So anyhow, that's where I am. And so it's a little bit of a different setting. I'm sorry for the spare walls back there. It's probably not as entertaining, but that's the way it is. So anyhow, we may have a small turnout tonight because there was some confusion on my part about how I set up the webinar, and I had failed to reset the time zone so that it reflected Seattle time zone. So there were a number of people that were showing up 2 hours ago because they thought it was an earlier webinar. So we'll see where it goes. And we may have time. Those of you that have showed up may get a lot of questions answered, and we may not have a long duration of a webinar tonight. So we'll see how that goes, okay? So for those of you that are new here, welcome. For those of you that are coming back again, welcome as well too. For those of you that are new, the way you participate in the webinar is just two ways to do it. And first is you can write a question to me. And the way you write a question to me is in the chat box. And you basically write it, and then I'll respond to it if I have enough time to get to those questions. The other way to participate is to just listen to the questions and the answers that I provide. I try to provide a lot of education around each of the questions, so you'll get some content out of that as well too. Okay, and yeah, so I know I think Jennifer says that she has 3 questions. Just write your question. Just write them in the chat box there, okay? So I hope that answers that for you. As usual, I am creating and recording tonight's webinar, and sometime tomorrow morning, I guess I was giving everyone an exact time, but I'm not always the greatest about getting it out exactly at the exact time in the morning. But somewhere tomorrow morning, Seattle time, you will get an email from me announcing that the recording is ready for you to see. And it will also contain a synopsis. If you watch the recording on YouTube, because that's one of your options, you'll actually have timestamps on it. And you can kind of click through to the areas that you want to see. Okay. So without any further ado, I think we'll go ahead and get started here. One thing I want to let everyone know too is that when you, during the webinar, I will be posting questions on the screen so you can actually see those questions. They don't really show up in the recorded version though. So I will read them out loud so that everyone can hear them as well too. Okay. All right. So let's go ahead and get started here. Hello, Erica. Let's see. Hi, Dr. Ross. Can you talk more about tafenoquine, when to consider it? Have your patients experienced any neuropsych side effects on it? Can this also be used with methylene blue? What would it be combined with for resistant cases of Babesia? All right. So everyone, tafenoquine is the newest anti-malarial that we are now using to treat Babesia. And if you notice, I said anti-malarial. The reason we use anti-malarials is like malaria, Babesia is a parasite that lives inside of your red blood cells, okay? Tafenoquine has really, I think it's kind of revolutionized our care for some people that are chronic and having difficulty recovering. We still don't have long-term studies about the benefit in any of the tick-borne infections, but we do have some mouse studies that look pretty promising for its ability to eradicate Babesia. So it's got a lot of people talking. So it's part of a family called the quinolines, and within the quinolines is tafenoquine, and there's an older one called primaquine. And I have used both in my practice, primaquine primarily before tafenoquine, but I think the tafenoquine is stronger. So what we're seeing is when to consider it is especially if you might have a strain of Babesia, which is called Babesia odocoilei. All right, so let's talk about that real quick. So historically, we've thought of the Babesia strains that people with Lyme have as primarily falling into 2 kinds, although we recognize there may be up to 20 different strains of Babesia. So even though we focused on 2, maybe there have been more that have been bothering people. The 2 that we have had historically definitive testing for is something called Babesia microti and another strain called Babesia ducani, okay? In general, Babesia microti is considered to be easier to treat and generally respond to things like malarone, tafenoquine, some of the standard ones we've been using over time. Usually microti is going to respond to that, okay? Ducani probably so too. But then there's been some consideration over the last few years that there's another strain of Babesia that we've kind of been missing out on or haven't thought about enough. And that is a strain called Babesia odocoilei that is been found predominantly in deer populations, but we're now beginning to wonder if it also is showing up in humans. And until recently, we did not really have a way of looking at it in humans. But we now have some ways that we can look for it. I'll try to describe those to you here in a minute. Generally, we think that Babesia odocoilei is a different animal, if you will, or different parasite, I should say, than Babesia microti and Babesia ducani. So microti and ducani, for probably 85% of people, these are infections that when you get on a regimen that includes like an atovaquone or a malarone is atovaquone with a quinine-like medicine thrown in called proquinol. But if you get on treatments that are pretty much oriented around one of those two drugs, generally for about 85% of people, ducani and microti are pretty straightforward. You just got to be on medicine long enough, which is usually about 4 to 5 months, and you're going to clear these in about 85% of the time, okay? What makes odocoilei more difficult to treat is it has the ability to sequester itself or hide itself away. And the way that it does it specifically is the germs have the ability to wrap themselves up in your blood clotting protein called fibrin. And they basically can get stuck deep within tissues in these fibrin nests. And also they get stuck up against your blood vessel walls in these fibrin nests as well too. So that makes them a little bit harder to get rid of. In terms of, so with that, tafenoquine is the newer killer on the block, and it just seems to be more effective, especially against odocoilei, okay? Now, until recently, we've been having shortage problems of it. So until recently, I generally have been trying to reserve it just for people with odocoilei. And then my patients that have microti and ducani, I've been tending not to use it unless I see their treatment failing, okay? And by failing, I mean, let's say I do a standard 4 to 5 month treatment of something and it's just not getting them better, then I might go to a tafenoquine. All right, so how do we identify if somebody might have odocoilei? So one is in people that have more treatment resistant, meaning 4 to 5 months of treatment's not working, start thinking odocoilei might be there. Okay, that's one thing, situation. The other situation is if you have done, IGeneX has their antibody testing for Babesia called Babesia called the immunoblot. And their immunoblot has the ability to see if you have antibodies, and it can specifically identify if you have antibodies against the Babesia microti, the Babesia ducani, and then also against the genus or the species of Babesia. So if you get back an immunoblot from IGeneX as positive for the genus, but it's negative for microti or negative for ducani, then that starts making you wonder if odocoilei could be there too, all right? Or if you get back a Babesia fish test, what a fish test is a microscope exam that looks to see, can they see the Babesia under the microscope, and they'll tag the Babesia with a fluorescent marker. So it's called fluorescent in situ hybridization. All that means is we've stuck this fluorescent marker on the germ so we can see it better, right? And the fish test that is done through IGeneX is a genus test, meaning it identifies anything Babesia. If that comes back positive and your antibody testing is negative, your immunoblot testing is negative, also think Babesia odocoilei, all right? And then finally, there's a newer way to test for Babesia odocoilei, which is known as a direct test, and it's through a lab called T-Labs. And T-Labs has developed a way to tag Babesia odocoilei and the genus test. It's kind of a fish test actually, but the T-Lab fish test is able to look at two things. It can do the genus, and it can actually do Babesia odocoilei. They're actually the only one lab that is actually specifically testing for Babesia odocoilei. All right. Now, the one caution I want to give everybody about these fish tests, we call them direct tests, meaning you see it directly under the microscope. You're not indirectly inferring that you have the infection because you happen to develop antibodies against it, all right? But literally you're seeing it, is on any of these direct tests, like even a blood culture would be a direct test. We're not clear how sensitive these tests are, meaning how good are they at finding the infection when it's there? Now, for Babesia, they might be pretty good. But when we look at fish testing or direct testing for Bartonella or Borrelia, for instance, I question how accurate they are at always finding when it's there, because literally the germs have to be in that part of the blood that you draw. And Bartonella and Borrelia don't necessarily hang out in the blood. They're actually hanging out in your cells and in your tissues. So we make it a sampling error that makes it so that when you try to do a direct test like a T-lab for Bartonella or a T-lab for Borrelia, when they come back negative, in my opinion, that does not exclude having the infection, because it just may have not been in that allotment of blood that you pulled out, okay? Babesia odocoilei and Babesia in general, because it is a blood-borne infection, it's pretty much going to be in every cell. So you should be fairly sensitive, I think, when it comes to Babesia, especially through T-lab, and the fish test through IGeneX, I think would be pretty good too, all right? So think about Babesia odocoilei. If you get if you get a T-lab that says Babesia odocoilei, all right, or if you've gotten, you've treated your Babesia for 4 or 5 months, you're just not getting better, you might start wondering, is this an odocoilei strain? Or if on your immunoblot test from IGeneX, you get back, it doesn't come back from microti, it doesn't come back from ducani, but it says genus, then you start wondering, especially if you're not getting better, that it could be an odocoilei as well too, okay? All right. Now, can you use tafenoquine with methylene blue? Absolutely. I see no reasons you can't do that. And no, I have not seen anyone have neuropsych issues on any of the quinolines, and that would be tafenoquine or the primaquine, okay? All right. And actually, let me look that out, because I need to look that up and see if that's even listed as a potential side effect. So hold on here a minute. All right, let's see here, adverse reactions. Well, that is interesting. I mean, they're saying suicide and psychoses, but I have to be honest with you. Anxiety, I just haven't seen this. And I've used even before I stopped practicing a couple of years ago and then came back into practice here recently. I just have not seen the psychiatric issues with it, okay? I know they list it, but I haven't seen that occur. The one thing about using tafenoquine, you need to get a type of blood test done before you use it called a G6PD. G6PD helps us understand the antioxidant levels within your blood cells. And if you don't have enough G6PD, it could be that you get into hemolysis or breakage of your red blood cells when you use a tafenoquine. So you want to check that as a screening test before you use a tafenoquine. The other thing, tafenoquine, there are 2 manufacturers, but these days only one is available in the United States. That's a product called Arcoda, and it's a 100 milligram pill. Most of us are finding when we use tafenoquine that you want to use for an adult, you want to get up to 300 milligrams one time each week. So it's as a medicine you take once a week, basically, okay? And then in terms of things you would combine it with, you could start just by using tafenoquine by itself. If you are a person that has significant herxes or is very sensitive, I'd start at 100 milligrams one time a week. If you're not such a person, you could go right up to 300 milligrams once a week. And then I usually will wait and see if there are herxes. Once those herxes have passed, then I might add to the tafenoquine atovaquone. And I like using it as the liquid for this situation. the combination of tafenoquine with atovaquone would be 5 milliliters 3 times a day, can be very good. And sometimes you can even add azithromycin to that, and you've got 3 things that are going after it. I also sometimes like adding cryptolepis into it. In my patients, I'm having a harder time. Cryptolepis being an herb that can kill Babesia, and I like using that at 5 milliliters 3 times a day. Other things to think about with your Babesia odocoilei, as I mentioned earlier, odocoilei has the ability to wrap itself up in your fibrin. So at some point, you want to add in lumbrokinase, which is a group of enzymes that come from the skin of earthworms, and they break up fibrin. And so you would want to add in lumbrokinase. There's a variety of products out there now. Allergy Research has a product. Candida RNA has a product called Baluki. And then Research Nutritionals has come out with their own lumbrokinase that, based on their studies, is even more potent than the other ones I just talked about. But you would want to do a 16 to 20 milligram pill 1 time a day. And if you're tolerating that well and your treatment's kind of blocked, then I might go up to 1 pill twice a day on that, or 1 or 2 pills 1 time a day. Keep in mind with your lumbrokinase that it, because it is an enzyme, you want to take it without food or medicines in your stomach, because if you have food or medicines in your stomach, it's going to try to digest them and will not digest up your fibrin nest, basically, too. Okay, and so what I mean by that is I usually tell people to stop all medicines or 1 hour either side of taking your lumbrokinase. So beginning 1 hour before taking lumbrokinase through an hour after taking lumbrokinase. Don't have any food or medicines or supplements in your stomach. You can have water. That's okay. All right. Okay. Whew, that's a lot of stuff I just said. So to give you, if you want to look more into this, take a look at an article I have. Okay, so this is my Lyme information site. Many of you know this, the Treat Lyme by Marty Ross MD. This is also my supplement store site. If you just click over here, you're drawn into the supplement section as well too. All right, and in terms of looking at how do you address odocoilei, or how do you address Babesia in general, take a look at my Lymology guides. Look under my infection plans here. And then take a look at my Babesia article here. And then if you were to scroll all the way down, let's see here, somewhere down here, I get into what I call the quinoline-based treatments, and that includes the tafenoquine. And I lay out different ways that you can go ahead and do this. Okay, all right. All right, let me go back here again. And hold on, I think my headsets are going dead. Let me just see something here. Ooh, that's not looking too good. We'll see how that goes. I may have to just switch to using the computer microphone here in a minute, but let's see if we can keep doing it here for a little longer. All right, let me go back. There we are. All right. Okay, let's see. Thanks for that question. I know that got a little long-winded, but I hope that gave you the information you needed there, Erica. All right. Hello, Tracy. Let's see. Hi, Marty. Last week, I asked you about high-dose vitamin C infusions for long COVID. You suggested limiting it to 8 treatments due to concerns about tissue damage from oxidative stress. I think the protocol calls for a series of 4 to 6 treatments with an initial dosage of 15 grams and treatment 1, and ascending up to doses of 60 grams of vitamin C in subsequent treatments. Do you have any thoughts about this dosing level? Also, is there anything someone could take before or after treatment to protect against repair possible tissue damage? So, I think, again, a dose that is going to be more killing of germs is when you get into an oxidative level of vitamin C. So many of you know vitamin C is an antioxidant, right? But if you actually start taking it at doses, maybe above 20 milligrams, it has oxidizing effects. And as an oxidative agent, it can actually damage membranes, okay? So it can damage the coverings of your germs and potentially kill them, all right? The problem that I have with it, though, is that it may damage your own cell membranes as well, too. I have never really found these to be effective germ killers. I know some of my colleagues would use them for viruses and use them for Lyme. I just don't think it works that way. What Tracy is asking about is a protocol of vitamin C infusions for long COVID. And frankly, I just don't know if it works. I think we're still trying to figure out what works for long COVID. But I think if they're only going to do 8 treatments, I suspect you're not going to have a worrisome level of oxidative damage to your tissues. I think it would be okay to do that. I think from what you're describing, it probably seems fine. Okay, I'm just not sure it's going to help. That's the main thing. All right. Good luck, Tracy. All right. I'm going to take out one headphone and see if I can get that recharged again here for a minute. Now, I'm not sure if you're all still hearing me. I'm going to put both of these in here for a minute. So I'm going to ask you, does everyone still hear me? Is anyone still there? That's the big question too. So I'm going to wait to see if anyone will write that they're still hearing me now that I took my earphones out there. Okay, great. Okay, good. Thank you. I just wanted to make sure. Okay, let's see. Next question is from Mary. Hi, Mary. Let's see. Hi, Dr. Ross. So grateful you will be treating again and wishing you the best luck with your new space. Thank you. This is my new space. Or one of the rooms in my new space, I should say. But thank you. Let's see. I have a question about SIBO testing. Know you use Genova, and I think you mean for the SIBO testing. Recently heard of another test that checks for 3 gases. The additional gas is hydrogen sulfide. Do you think it's useful information to have 3 gases measured? Also, do you think a SIFO is important to differentiate? And is SIFO related to intestinal yeast? I understand that SIFO is only measurable with stool testing. Thank you. All right. So I have to look into this newer test you're describing. I'm not familiar with it, and I'm not sure if it's more helpful to have the hydrogen sulfide or not. I haven't looked at the science on that. Okay, so I apologize. I can't respond to that right now. At least I can't respond to that. But in terms of what I think about SIFO, okay, so let's talk terms here. So there is SIBO, and then there is SIFO. All right, so SIBO stands for small intestinal bacteria overgrowth. SIFO stands for small intestine fungal overgrowth, or what we mean is yeast, okay? Candida yeast, basically. All right, now, the issue is your small intestines are not supposed to have many germs there, okay? Compared to the large intestines. The large intestines are loaded with germs, including yeast. All of us have some degree of yeast in our intestines. Candida yeast, all of us have some level of that. Meaning we cohabitate with it, okay? And your small intestines have some degree of bacteria and some degree of yeast too. The issue is if those quantities of germs grow too much, then what starts happening is if it's bacteria, they can ferment food, producing methane and hydrogen gas, which will make you very gassy and bloating and cause maldigestion, if you will, all right? In the case of yeast that grow too much up in the intestines, they also will digest all the sugars in there and make you really gassy and bloated as well too, okay? All right. In terms of the breath testing, it's better at picking up, we don't have, as Mary suggests, we don't have a way of testing for SIFO yeast in the intestines. And actually, I would suggest that even stool testing isn't relevant. So when you're doing stool testing with stool measures is stuff from the large intestines. not the small intestines. It's small intestines is too far up to adequately influence what's coming out in the lower intestine testing, okay? So I would argue that we actually don't have adequate testing for SIFO in terms of the breath test or stool test. The only way we could really test for SIFO is if you had an gastroenterologist, an intestinal specialist that would go in and do endoscopy, where they put the fiber optic tube down into your stomach, but then they continue down into the small intestine and they aspirate fluid back out. And then you could look and see that there are a lot of yeast in there, okay? In fact, the breath testing for SIFO, where we're basically in a breath test, everyone, what we're doing is we're having people swallow some sugar, and then we measure over a 2 or 3 hour period how much, at intervals, we measure how much methane and hydrogen come out, okay? All right. And if you're fermenting the food you eat, you're going to produce either methane or hydrogen. And that's what we're measuring, all right? But the breath test ability to actually pick up SIBO is only 70%. All right. So you can still have SIBO and have a negative test. The best way to see if you have SIBO is not to do the breath test. It's actually to have a gastroenterologist put a tube down you and suck out some of that fluid and send it off to the lab. Now, practically none of them do that, but that is the gold standard way to go ahead and look for it. And that would be the gold standard way to look for yeast in your small intestines as well, too. Okay. All right. So how do you figure out if you have SIFO? Well, generally, my starting approach to anyone that has a lot of gassiness and bloating is to probably think it's intestinal yeast. And I don't differentiate whether it is large intestines or small intestines. I will just treat. So if somebody's got a lot of sugar cravings, gassiness, and bloating, and they have other signs of intestinal yeast, like having lots of rashes on your skin, which are not yeast directly on the skin, but when you have too many yeast in your intestines, as they release chemicals that get into your bloodstream, interact with your skin, and can make it so you get pimples and acne, can make it so that you have eczema that's a lot worse, make even psoriasis might get worse. Anything skin related, if you have intestinal yeast, will get worse, okay? So I'm asking people questions to see if they have too many yeast based on symptoms. So if they have sugar cravings, gassiness and bloating, if they feel a lot worse after having sugar, meaning after they feed their yeast, if they've got changes in skin like I was just mentioning, and in females, if they have a lot of vaginal itching, vaginal discharge, or get repeated vaginal yeast infections, you got to start thinking about intestinal yeast. And sometimes that could be small intestine, and sometimes it could be large intestines, and you don't have to make a distinction. The approach is to kill those yeast, all right, and to put good bacteria back in, all right. If that doesn't work, then I'm going to go ahead. My next process is to get a SIBO breath test and to see if we're actually having bacteria overgrowth producing all that gassiness and bloating. So my approach, though, is just deal with the yeast up front. And I don't try to identify whether it's large or small intestine. Okay. All right. So let me show you where you can read more about that. All right. And so we're back here at the site again. Okay, so if you look at my article on small bacteria overgrowth, I do talk about my approach, which is make sure it's not yeast first, just basically deal with yeast first, okay? And if treating for yeast fails, then come back and look for SIBO, okay? All right, and I talk here about how you would go after SIBO. I will mention restricting, going on a FODMAP diet, which restricts the kind of foods that would feed the bacteria in the small intestines, is a good approach initially. It shouldn't be done chronically. And then I talk about the differences between how you approach hydrogen producing versus methane producing. Methane's a little bit harder to get rid of, okay? So you can take a look at this article here for that too. All right. Thanks for that question, Mary. Good luck to you. Hold on here a minute. Let's see. Hello, Joan. Let's see. If I'm on ceftriaxone IV, should I also be taking fluconazole to control yeast? So I would probably regardless of whether you're on IV or prescription antibiotics, I always think in tick-borne illnesses, it's a good idea to do things to control yeast from growing too much in your intestines, okay? And so my basic approach is something that I outline in my Ross support protocol, but I'll just tell you about it right now, okay? Which is you got two options. You could either take, as part of your prevention strategy, I recommend using prescription nystatin. You can get it as pills. It comes as a 500,000 international unit pill, and you do 2 pills twice a day. And you want to combine that with some probiotics. Okay, all right. That's one approach. If you don't want to use prescription nystatin, you could also control yeast by using herbal anti-yeast medications. And the one product I like using for my herbal anti-yeast medications is to take a product by Karuna, that's Karuna, their product called Capri Plus, which is caprylic acid, garlic, and some oregano oil. And I like using that as 2 pills twice a day. So for yeast prevention, whenever you are on prescriptive antimicrobials, oral or IV, I think it's a good idea to either be on nystatin or the Capri Plus, and 2 pills twice a day of either one of those, and then make sure you're on good probiotics as well too, okay? And you can read more about that. I'll show you one place that you can read more about that. So take a look. I describe it in a number of places, but look at my Ross protocol. And if you look down here in the yeast section, I talk about preventing or treating. Okay, all right. So for prevention, I give you some ideas on what to do for probiotic. Okay, but then in terms of antifungals, you can either use, as part of preventing, you can do the herbal combination or you can do nystatin. I think I talk about that here, but it's in here. All right. All right. Let's see here. Go back. All right. Thanks, Joe. Good luck to you. Hello, Tracy. Hi again, Marty. Can you remind me what can be done to minimize a Herx? Yes. So the frontline approach, in terms of even what I build into my protocol, is in the protocol, one thing I advocate is that everyone, as part of their treatment, should be taking an herb to lower your cytokines, all right? So everyone, let me talk about what cytokines are first and why they're involved in Lyme, and then also why they're involved in Herxheimer reaction. So when you, whenever you have an infection in your body, whether it's COVID, tick-borne infections, a cold, the first thing that your immune system does, the white blood cells, will release a bunch of chemicals called cytokines, all right? And cytokines are good and bad. On the good side, they actually try to turn your immune system on to deal with that invader, all right? The trouble is in tick-borne illnesses and in mold toxicity and in too many yeast in your intestines and in long COVID, the immune system doesn't seem to turn off. And it keeps trying harder and harder to get rid of these infections. And as it keeps trying harder and harder, it just starts dumping out all kinds of cytokines. And you get into a situation of cytokine excess, okay? In long COVID, it could even be that the infection is gone, but you have an immune system that just too revved up to keep making cytokines, and it just keeps dumping them out. It doesn't turn off, okay? So one of the ways that you can lower cytokines, so why that's important is too many cytokines give you the symptoms we see in mold toxicity or that we see in tick-borne diseases and some of the symptoms you have in long COVID, which is too many cytokines make it so you can't think, disturb your sleep centers, give you fatigue, make you hurt all over, etc., interfere with your hormonal releasing of hormones, etc. Okay, all that stuff gets messed up, right? So, and if you have too many cytokines, instead of actually helping your immune system, they suppress the immune system. Now, when you start killing germs, the immune system sees the dead bug parts, proteins and toxins from the inside, and it reacts by making more cytokines, okay? So you get worse. So the approach to dealing with a Herx is to be preventive at first and then take some additional steps. So the prevention is, and this is anyone that is on a Lyme treatment, they should be doing things to control cytokines, because lowering cytokines, even before Herx, is going to help your immune system work better. It may even help you feel better too, all right? So step one, I like using liposomal curcumin. The product I recommend that is liposomal curcumin is a thorn product called curcumin phytosome. So liposomal means it's microscopically wrapped in layers of fats to help increase the absorption of the curcumin. And it's important you increase the absorption because it's not well absorbed, all right? So you want to get it inside. Now, curcumin inside of your cells, inside your white blood cells, blocks the factory production line of cytokines, okay? All right. And so I like to suggest that people, as a routine maintenance to keep your cytokines under control, even before Herx, take curcumin phytosome 500 milligrams 3 times a day. That's what I suggest, okay? All right. Now, if you start getting into a Herx, which is you killed some germs and you now have a cytokine surge, the first step is I'd like to double that to 1,000 milligrams 3 times a day, okay? The other thing you can do in a Herx too, to help to even more quickly get some of the cytokines down, is to work with liposomal glutathione. So liposomal glutathione, liposomal means it's microscopically wrapped in fat, okay? And as you know, glutathione is a strong antioxidant made in every one of our cells. It's also used by the liver. It's the main detox chemical as well, right? But as a powerful antioxidant, what it does for cytokines is it helps block the oxidation signals made by the immune system that tell white blood cells to make cytokines, okay? So you can kind of think of curcumin as being inside the factory, interrupting the factory production line. And then from the outside, the factory's got to get a signal of oxidation agents, and glutathione stands out here and blocks the signal. So you're stopping the signal to make cytokines, and you're interrupting the factory production line, okay? So it's a double whammy, all right? And so the way I like to use my glutathione is I like a product for that made by Research Nutritionals called Tri-Fortify. It's a product that's got good science behind it, showing great absorption, and that's the problem with most glutathione. It's horribly absorbed, but Research Nutritionals formulation actually has got good science showing absorption, okay? All right. And their product is called Tri-Fortify. That's TRI-FORTIFY. And you would want to do a teaspoonful 1 time a day. And for severe Herxes, you might even go up to 1 teaspoon twice a day. All right. So that's my approach. I know there's a lot of people that try to do all kinds of binding of toxins in the intestines, et cetera. But this is not necessarily a toxin problem. This is a cytokine overproduction problem. So I like to interfere with that cytokine overproduction problem by both blocking the signal that tells the white blood cells to make it using the Tri-Fortify, and then also working with the curcumin, okay? All right, so let me just show you those 2 products here real quick. And actually, let me show you my article where you can read about how to manage Herxheimer reactions too. All right, so I have a whole article on Herxheimer reactions. Okay, so read this article, Herxheimer die-off reaction, inflammation run amok, where I talk both about curcumin and about glutathione, and I even give you some other ideas, okay? I would take a look there. And then in terms of supplements that can help get your cytokines down, take a look at my store, and then I would look at this section on cytokines and Herxheimer reactions, all right? And I would look all the way, I don't know why it looked that way. I guess this is set up on alphabetical, but so anyhow, the glutathione, there's a variety of sizes they have, but here's the glutathione products, this Tri-Fortify I was talking about. And then the curcumin, this is the thorn curcumin product I was talking about too, okay? All right. All right. Thanks for that question, Tracy. Hello, Mira. See, can you take Biocidin LSF at the same time as Baluki? Thanks. That's a good question. I probably would not. I'm just thinking, what I was trying to think of is the components of Biocidin. Would it be digested by Baluchi? And the problem is, Baluchi is basically a fibrolytic, but it's an anti-protein. So, and even though Biocidin has various plant herbs in it and garlic, components of those are proteins. So I would think that your Baluchi is going to be wasted if you take it with something else at the same time. Okay? All right. Thanks, Mara. Hello, Mira. Let's see. Hi. Is IVIG helpful in Lyme treatment? Does it give false positives with any follow-up Lyme testing? Thank you. That's a good question. So intravenous immunoglobulins means giving somebody antibodies. Okay. All right. And in terms of your testing is an interesting question. I think it could. The way that the IVIG is collected is it's basically collected from a pool of donors that donate their plasma or their blood, and then that blood is the immunoglobulins are cleaned out, and it's multiple donors, right? So it is possible if one of those has had Lyme sometimes in their lives and they're still making antibodies, that perhaps that might show up. So I think it's a good question. How long would it take after an IVIG infusion, before that risk goes away? I don't know off the top of my head. I have to look into it a little bit more. But in theory, I think, yeah, that is something to be concerned about. It used to be years ago, maybe about 15 years ago, I think there were a lot of people that were trying, a lot of my colleagues were trying IVIG for people that were having difficulty recovering from Lyme, anyone, okay? And I don't think that across the board we saw most people have help from it. There are some situations, though, where I think that IVIG, giving antibody infusions, can be helpful. One is if you've got somebody with a documented low level of IgG antibodies, okay? So, and let me talk about that for a minute, why. So there are some immune pathology problems with people, immunopathies that people have, in which they may not make large levels of IgG antibodies. So let's talk about antibodies for a minute. So whenever you first get sick with an infection, the first family of antibodies you develop are called IgMs. And then that's followed, those are supposed to go away in most infections, but they don't always in Lyme, all right? But they're supposed to go away, and then they're supposed to get replaced. The immune system will start making IgG antibodies, all right? Now, in Lyme and Borrelia, about 50% of the time, the IgMs don't go away. We don't know why, but there's theories, but they don't go away. So even in chronic Lyme, not acute Lyme, but in chronic Lyme, you can sometimes still keep making IgMs. And we think we're seeing that same situation in Bartonella and occasionally in Babesia now as well too, all right? Right. Now, there's a big difference between just acute and chronic levels, okay? So IgM is what happens first, IgGs. Now, IgGs are the memory of your immune system too. So in theory, once you've had an infection, even if you got rid of it, you're going to still make IgGs. Now, the levels may fall, but that you're still making IgGs. So I know a number of my colleagues want to go back and repeat immunology or the IGeneX immunoblots and try to look at, well, are those antibody levels decreasing? Well, it's not relevant because the IgGs may still remain even after the infection is gone. That's how the immune system works, okay? All right, so I don't do repeat testing. I don't think it tells you whether you're getting over the infection at all or not, all right? Now, there's another big difference, okay? IgGs are much smaller in size than IgMs. IgGs penetrate more deeply into tissues and can clear infection. IgMs do not clear an infection right away. They set up a bunch of other immune processes that will help lead to clearing of the infection, but it's IgGs that clear an infection. So if you are not making enough IgG antibodies in your blood, it does make sense to do IVIG infusions or injections to be able to raise up your IgG levels to clear infection, okay? All right. All right. The other place that we see some benefit from doing IVIG is if you've got people with a type of neuropathy that can be triggered by Lyme or can just be triggered for other reasons as well too. And that's called small fiber neuropathy. And in small fiber neuropathy, IVIG is recognized as a beneficial treatment. It's actually paid for by insurance. The way to get coverage for that is you actually have to get a skin biopsy where they look at the nerves in the small fibers in your skin, and they can tell whether they're damaged or not. And if they diagnose you as small fiber neuropathy based on a skin biopsy, you should qualify with your insurance company to get IVIG infusions done. Okay? All right. I hope that answers your question for you. Good luck to you. Hello, Harrison. Hi, and thank you for offering these webinars. What is the most effective treatment for Bartonella remission? So Harrison, I guess there's a couple ways I could interpret that. One is, do you mean to get it into remission, or do you mean to keep you in remission? All right. So I'm gonna take the angle to get you into remission. And what I would say is, I guess I don't know. Maybe I'll try to answer that both ways. So to get you into remission, if you were to look at my Bartonella article, you're going to see that I recommend, I think what is the strongest Bartonella combination is to do an azole like diflucan or itraconazole paired with methylene blue. Okay. From an herbal standpoint, I think your strongest would be to do a Japanese knotweed, cryptolepis, liposomal cinnamon, clove, oregano combination. All right. All of those can be strong to get you into remission, okay? Now, in terms of this idea of Bartonella remission, and this holds for tick-borne infections in general too, what we are not clear about when somebody recovers from tick-borne illness is, did we wipe the germs out? Are we able to eradicate? Are we able to completely remove the infections? Or is the best that we're doing really knocking them under control so that the immune system can step in and keep them under control, okay? All right. And so that would be called remission, which is you've got somebody that you get them into a healthy state and their germs are still there and the immune system is working to keep them under control, right? So in terms of things to think about in terms of keeping somebody in remission, first of all, whenever I get somebody well from tick-borne illnesses, I'm not going to do anything overtly to keep killing Bartonella. Generally, my approach is to keep the immune system working well. So number one, get sleep, right? 7 to 9 hours of sleep a night. Number two, exercise to tolerance, but exercise and sleep are some of the best immune system stimulants that you can do, okay? Number three, decrease stress. If that means getting out of that job that's stressing you, because stress kills the immune system, okay? Or if it means rethinking your relationships to your job or to your partner or whatever, it just got to deal with the things that are stressing you. Maybe take up a meditation if you need to, for instance. Okay, so so sleep, exercise, decrease stress. Those are some of the most powerful things you can do to help your immune system work well to keep your germs under control. All right. Number four, be on a healthy diet, like a Mediterranean style diet. That's anti-inflammatory. All right. And can help your immune system work well as well too. All right. Then if I've got somebody that I had worked with and got them well, I usually will suggest to them, we just don't put them on any germ killers at that point. We'd see what's going to happen. Now, if they should start to relapse, I want to get them back into treatment again. And then the next time when we stop things again, then I might think about leaving them on some herbal antibiotics to keep them in remission. All right. And I might look at doing like a Japanese knotweed instead of at 30 drops twice a day like I do to get people into remission. I might do it as 15 drops twice a day. I might pair that with cryptolepis at a quarter teaspoon 3 times a day instead of a half a teaspoon 3 times a day. I recommend when I'm doing a full-on treatment, okay? So you often can get by using lower doses, if you will, to keep people in remission, okay? And then, the reason I advocate using herbal antibiotics as part of a remission versus prescription antibiotics has to do with the gut microbiome, all right? So increasingly, we're recognizing the importance of the healthy germ load that you have in your intestines, all right? That's called the gut microbiome. And all of those germs in the intestines release all kinds of chemicals that direct every organ system in the body. All right. So if you've been participating in my webinars lately, you know I'm saying that the gut, your microbiome, is the brain of the brain. It's the brain of your immune system. All right. So what happens in the gut microbiome directs your immune system. So the last thing I want to do is leave people permanently on prescription antibiotics if I can avoid it, so that I don't knock down good bacteria in the intestines and hurt the immune system that way. All right. And so when we look at antibiotics, herbal versus prescriptions, your herbals have less of a chance of harming the healthy intestinal microbiome compared to your prescriptions. And so in terms of a preventive regimen of germ killers that I would do in addition to getting sleep, exercise, et cetera, all those things I just said, I would consider herbals versus prescription. Okay. All right. Good luck to you, Harrison. I hope that answered your question. Hello, Jennifer C. I was treated in 2015 by Lyme literate doctor for Lyme. At certain times since then, I have suffered from what was diagnosed as rheumatoid arthritis. I'm thinking it could be Lyme antibodies that can be flaring. Can you help me understand if this is a possibility? What do you recommend? Also, I just got a tick bite on Monday. It formed as a bullseye. How long should I take Doxy? My NT faxed me a script for 30 days. Is this overkill? Should I get the tick tested, or is it not necessary? Okay, so in terms of tick bites, let me just talk about how you approach that first. So if you have a tick bite that gives you symptoms, then you need to treat for a long time. All right. So, I'll tell you what I mean by a long time. So by symptoms, I mean a bullseye rash is a symptom, or that's a sign. I'm sorry. If you get signs and symptoms, okay. So if you have a sign of a bullseye rash, that means you treat with antibiotics definitely. Or if after that bite you start getting achy joints, you get arthritic muscles, you get brain fog, those are symptoms, all right? So if you have a bullseye rash after a tick bite, or you get symptoms, flu-like symptoms pretty quickly, that means you're going to want to treat for about 6 to 8 weeks with doxycycline, okay? 6 to 8 weeks. And I lay that out in my article on how do you handle an acute tick bite, okay? Now, if you get a tick bite and you are in an area where there's a high possibility that those ticks can carry Lyme, like in the Northeast, Upper Midwest, meaning Minnesota, Wisconsin, meaning the Upper Peninsula of Michigan, meaning Northern California, those areas you probably ought to consider being on antibiotics. But if you don't have symptoms, I mean, no bullseye rash, no flu-like symptoms, then the recommendation is 3 to 4 weeks of doxycycline in those kind of situations, okay? Now, why am I saying to be so aggressive if you have symptoms like a bullseye rash? Well, we know there's good studies that tell us that if we use only 1 month of Doxy, that about 15% of people in those situations will go on, well, 15 to 20% of people in those situations that used only 3 weeks to 4 weeks of Doxy in an acute situation with symptoms, that 15 to 20% will fail treatment and go on to develop chronic Lyme. And you want to prevent that chronic Lyme. You know that well, okay? So up to 8 weeks is probably better if you've got bullseye or symptoms, okay? All right. And that is part of my article on how do you treat an acute tick bite. And I'll show that to you here in a minute. All right, then. So the problem is, so I'm not sure how they're making your diagnosis of rheumatoid arthritis, but what I'll tell you, rheumatoid arthritis is basically, you do some blood testing, but there isn't a blood test that proves rheumatoid arthritis. It's just a test that informs the decision-making. And then they look at the kind of arthritic pains and swelling, et cetera, you have, and they call that, they check off enough boxes, that's called rheumatoid arthritis, all right? Now, is it possible that tick-borne infections trigger the immune system to start attacking the body? The answer is yes, all right? So it may mean you've got some action of tick-borne infection still in you, like Lyme, but it also may mean that the immune system is overreactive. And so from the immune system side, what I like to do in situations like this is to work either with a peptide to turn on your immune system or low-dose naltrexone, all right? So now, and so let me explain that for a minute, all right? So whenever you get an autoimmune illness, what we recognize is that there's some imbalance in your inflammatory system. And so for that discussion, I want to talk about something called Th1 inflammation, Th2 inflammation, and something called Th17 inflammation, all right? So Th1 inflammation is made up of the white blood cells and T cells that attack your infection, okay? Chronically attack your infection, all right? Th2 is made primarily up of your cells that make antibodies. It's made up of your mast cells, okay, which are your allergy type cells, all right? And then Th17 is made up of immune cells, a variety of immune cells that line your mucous membranes and sit just under your skin surface that are supposed to attack invaders that your immune system has never seen before. It doesn't recognize it, okay? They're the frontline defense, all right? What we think happens in autoimmune illnesses is that Th1 and Th17 get turned on, and in return, Th2 gets suppressed. And what we want to do is get these rebalanced so that the Th1 and Th17 aren't overreactive, and we want to get Th2 up to the level it's supposed to be working at, okay? The way to do that is to alter another type of white blood cell, which is called a T regulatory cell. Your Tregs are the regulators, all right? They regulate how much Th1 is there. They regulate how much Th2 is there, and they regulate Th17. They're kind of like the parent in the room of these three different kids, all right? And they're up here screaming to the kids over here, jumping on the couch too much, knock it off. And versus the kid down here that is too shy and embarrassed, they're trying to encourage it to come back up. That's your Th2, okay? All right. So what upregulates Tregs? Well, low-dose naltrexone. Or you could use a peptide product that is designed to turn on your Tregs as well too. All right, and that peptide product is a product made by Integrated Peptides, and the bioregulators that are in it. These are short strands of amino acids that are designed to turn on your thymus gland. Have the potential benefit of being able to get more Tregs. All right. So option one is use this product by Integrated Peptides called Thymogen Alpha 1. And I want to let you know it has not been researched to say that it does help in these situations, but the design of it is that it should improve T regulator function. Okay. And you would do one pill twice a day. So it's called Thymogen Alpha 1. It's got two thymus gland bioregulators, bioregulates, try to turn on and help the thymus gland work better. Okay, all right. Or you can use low-dose naltrexone. Naltrexone, you may be aware of, is a narcotic blocker. We also use it in alcoholics. But what it does is our body makes a natural group of chemicals called endorphins. They are involved in pain regulation in us, but endorphins also regulate the immune system. And if you block the endorphin receptors with low-dose naltrexone, and you do it for short-term blockages, what happens is the brain doesn't like that, and it tells the endorphin-producing cells to make a lot more. And in addition, these receptors get turned on and become more sensitive to endorphins. So in 4 to 6 hours after you take your naltrexone, after it wears off, these endorphin receptors get flooded by all this extra endorphins, and they're more sticky. They hold on to it better, so they're more reactive to it as well too. And that has the benefit of regulating the immune system, creating balance in Th1, Th17, upregulating Th2. Okay, all right. So I know I just said a lot of stuff. Let me just show you an article that you can look at that. All right, so I'm just going to put up here, I think it's called Tregs. Yeah. All right, so here's my article on how to boost Tregs to balance Th1, Th2, and Th17, okay? In terms of where you would go to get that peptide product I was just telling you about, you could go to the relationship I have with Integrative Peptides here, And the product is called Thymogen Alpha 1. Uh-oh, I wonder if they're out right now. Oh, let's try here. Huh. I wonder, oh, there it is. This is the Thymogen Alpha 1 product right there. Okay. All right. And then let me go back here. And then in terms of low dose naltrexone, I do describe it here, but I also have a whole article just on low dose naltrexone. And that's this article right here. Okay. All right. Jennifer, good luck to you. Hello, Mira. Let's see. Is it better to take one pill of cinnamon clove oregano twice daily, or can I take 2 pills once daily? Is it best to take on an empty stomach? Can I take it at the same time as rifampin minocycline? I'm treating Lyme and Bartonella. Thank you. So first of all, you can take the liposomal cinnamon clove oregano at the same time you take rifampin and minocycline. I do not recommend taking 2 of the pills at one time. It is so these are volatile oils. Volatile oils are very irritating to the stomach and the intestinal tract, all right? So probably taking about the quantity that's in one pill is enough without getting too irritated, all right? So I just want you to know that. The second thing is we want to basically hit your germs twice. So when you take liposomal cinnamon clove oregano, its effect probably is going to be pretty immediate, and it's not going to just get in your blood, stay there, and keep having a regular effect. This is something I think you want to hit the germ with twice, basically. Okay, all right. And the second part is, from a tolerance standpoint, be able to tolerate it. Boy, taking 2 of those pills at once, I think would be extremely irritating to both your food pipe and your stomach lining as well, too. Okay. Hello, Kay. Let's see. Hi. Why would tick disease's symptoms get worse after injury in an auto accident? And what can be done to help? Thanks for your help. I'm not, I would have to investigate with you a little bit more what happened around that accident. But the car accident itself, the trauma that you had, probably in and of itself would not be causing a resurgence of tick-borne illnesses, right? But if you had a lot of stress around that from being in a car accident and the terror of getting hit and the pain that came about from it, that could suppress the immune system. That kind of stress could be suppressive to the immune system, right? The second thing is I would want to know, what did they give you after the car? I mean, did you have to go to the hospital? Did they see some open wounds? Did they decide to give you antibiotics? And if they did, maybe those antibiotics you took could have led to too many yeast growing in your intestines. And the relationship is too many yeast trigger all those excess cytokines that I talked about earlier. So a big reason when I see somebody that has a decline, I'm always wanting to know, is there something else triggering excess cytokines? Remember, I mentioned earlier that when you have tick-borne infections, you get too many cytokines. That's what makes you feel bad, okay? Too many yeast in the intestines trigger too many cytokines, and that makes you feel bad. And if they gave you antibiotics for any reason, that could have set you up to get too many yeast. Stress will set you up to get too many yeast. So you may want to take a look at my article about how do you diagnose too many yeast. And if you happen to do that article and you start thinking, maybe I got too many yeast, that may be something to consider as well too. But the car accident itself, I don't see how that would do it itself. Okay. All right. So let me just do a screen share here for you. All right, so in terms of yeast, take a look in my yeast section here. And then look at my article about, is it a sign of problem? Is it yeast? And within here, I do walk through how do you go about diagnosing it, okay? All right. Good luck to you, Kate. Hello, TI doctor. What and how much do you recommend for a 2-year-long swollen knee dealing with Lyme, Babesia, Bartonella, anaplasmosis, mold, gut, yeast, MCA symptoms? Currently taking methylene blue, Byron White, Beyond Balance, Minnow, hydrocortisone, nystatin, ketotifen, methylene blue. Recently increased to 50 milligram, which may be nauseous. Okay, so if you've got a 2-year-long swollen knee, I hope that somewhere along the way, somebody's done an x-ray of that knee to see if there is a non-infectious reason for your perpetual pain and swelling. All right. So for instance, if as we age, sometimes our bones, wherever two bones come together in a joint, all right, that's two bones coming together in a joint. These surfaces of the bones are covered in a layer of cartilage. You've probably heard of cartilage before, right? And the job of cartilage is, first of all, it's smooth, so it allows bones to glide over each other easily. And secondly, it's a lot softer and spongy than the bones it covers, so it acts as a shock absorber in a joint. All right. Now, it is softer than the bone it covers, and it can wear down. And as you start wearing down, you can get bone rubbing on bone, which leads to inflammation and pain, which can lead to ongoing swelling in the joint. Okay. Also, if you've got some tearing of the structures inside the knee joint, like your anterior cruciate ligament or anything like that, then you're going to have chronic inflammation too. So I hope that somewhere along the way that somebody has gone looking to say, I want to make sure this isn't Lyme related. They need to make sure, or let me put it a different way. People with Lyme get regular health problems. Okay, so we've got to be careful that we don't see everything as being caused by Lyme, because the other things happen. Like you can get osteoarthritis in your knee. All right, so now maybe you already know if it's osteoarthritis. Maybe somebody has suggested it. Okay, so if it is osteoarthritis, meaning if you have worn down your cartilage in your joint, you have bone rubbing on bone, there is a newer product that came out. It's got some really impressive science behind it. And it is a product that has celery seed and boswellia in it. And it's called Cartigenix, Cartigenix. I'll show it to you here in a minute. It's got, and basically the idea is that even when you've worn down cartilage in your joints, there are still what are known as chondrocytes. These are cells that will make cartilage. But they won't start making cartilage until inflammation is knocked down. And then once they do, then the inflammation does get knocked down in that joint, they'll start making cartilage again. All right. So this product called Cartigenix, you do 1 pill twice a day. In the studies where people were enrolled, some of them had bone on bone inflammation. I mean, really bad stuff. They were able to show in 3 different studies marked signs of improvement. In one of the studies, they showed that the cartilage thickened by a majority of people using this product. Not everyone responds, but a majority of people, right? And I think in that same study, they measured cartilage markers of cartilage production, and the cartilage production went up as well too, all right? In all 3 studies, they were able to show that people became more mobile being on it, and that pain levels went down significantly in all 3 of these double-blind randomized studies that were done as well too, all right? So if this is osteoarthritis swelling, consider trying that product called Cartigenix, which has some science behind it showing what I just said, all right? It can help, all right? But the other thing to consider is if you had looked at it and somebody said, no, it's not osteoarthritis, is in addition to trying to kill germs that may be contributing, I would look at doing curcumin, that liposomal curcumin phytosome I talked about earlier, 500 milligrams 3 times a day. I might look at using the low-dose naltrexone I just mentioned a little bit ago to get some of your inflammation balanced, or the thymogen alpha one that I mentioned just a little bit ago. And then I would try to rebuild healthy structures in that knee joint by using a peptide product called BPC 157, all right? All right. So, and that would be a 1 pill twice a day on that too. Okay. Those are just some things to think about. You might want to talk to your healthcare provider about that. Obviously, you should talk to your healthcare provider about that. All right. So let me just show you. So this BPC 157, everyone, is a peptide that is made in the stomach lining. And it historically is made to help regulate your stomach and your intestines. Athletes long ago discovered it's great for tissue injuries in their joints. I've used it in tick-borne infections to do tissue repair. It also can help with nerve repair as part of tissue repair. It supports your energy factories called mitochondria and your cells to work better too. And it can regulate inflammation as well too. So I kind of like using it as a frontline repair, immune balancer, energy supplement, if you will. That's how I like using it in my practice. Okay. All right. So I'm going to do a quick screen share here for you. I'm going to show you a couple things. All right. So that product I was mentioning, this is the cardigenics that can help with cartilage in your joints. Okay. All right. And then in terms of, I'm trying to think what else I was going to show you here. Oh, peptides. All right. So then in terms of, that's not going away. That's got to go away. That's got to go away. I don't know why this is behaving the way it is. Let me go back here. Get off this page. There we go. Okay. So if we look here in my Lyme guides, if you look under the section called Repair and Restore, you're going to find my article on peptides. All right. And in here, I review a number of the orally available peptides that you can find today. And I do describe basically what peptides are, how they work. And here is my article on, or my description of BPC 157 and what it can help with. And I talk about the bioregulators here. And specifically, I talk about the thymosin bioregulators. These are the ones that are in that thymogen alpha 1 that I was talking about. But if you're looking for more detail about some of these things on peptides, take a look at this article, okay? All right, T, good luck. Hello, Myra. Is it possible for HED heads to resolve with Lyme and Bartonella treatment? We do not have EDS genes in the family, so hypermobility is an unexpected development that I can understand can come from tick-borne diseases. Thank you. So, Ehlers-Danlos syndrome, EDS, has a genetic predisposition, and I have found that it can be worsened. For some people, their EDS does tend to get worse when they have tick-borne infections, okay? And I also have found people that don't have frank Ehlers-Danlos syndrome but do get lax joints, probably because Borrelia in particular likes to burrow into tissues. And in burrowing into tissues, it releases enzymes to destroy tissue so it can get further in, okay? Especially probably in your tendons and ligaments. And that's going to wind up causing those lax joints, basically. So yes, I have observed it. Now, it has been my observation, I don't have a lot of cases though, okay, but it has been my observation that these lax joints can get better as you get your germ load down. I would also probably spend some time working with like a BPC 157 to repair the tendons. And I would also work with type 1 collagen, a product that has type 1 collagen in it to help repair some of the broken down filaments and fibers that are found within your tendons and ligaments that keeps everything held together tight too. Okay. All right. Good luck to you, Myra. Hello, Linda. Let's see. I'm apparently now clear of Lyme, but symptoms of Bartonella, even though a genetics test was negative. Responding to methylene blue, etraconazole, etc. My problem is heart damage, and I'm soon to undergo heart surgery. Cardiologist says no risk factors other than previous Lyme disease. I cannot get into our Lyme clinic without a positive test and rely on your website. Any suggestions for heart damage? Gosh, I would need to know a little bit more about what they're seeing. Like, do you have congestive heart failure? Are you having rhythm problems? I would need to know a little bit more. And unfortunately, we don't have the ability to do that in this forum. I'm glad to hear that you're doing better with the Lyme, though. I'm sorry about your heart. So good luck to you, Linda. All right, let's see here. Let me go back to these again here for the last part. Nope, it's not charging. I think my case is dead. Anyway, I saw one of you made a comment, Eileen, about everything is fine as long as I'm talking right into the screen. So I hope I haven't sat back so far that you aren't hearing me well enough. When I finally get all of my, as many of you know, I've just moved into the clinic here. My home is on its way, packed up and finally on its way from Austin. And when it arrives in about another week and a half, I get my good microphone back and we won't have problems like this again. But for now, we'll keep making do. Okay. All right. Let's see here. Hello, Amanda. Let's see. Still hear you. Do you have advice for a 17-year-old boy who has had very high candida levels on GI map testing for many years, first tested around age 3 and was born with yeast rash? He's undergone years of antibiotic and herbal treatments, first for pandas and eventually Bartonella. Thanks for your advice. So, yeah, I mean, so first of all, in terms, and I'll show you my whole article on this too, but you want to do kind of a weed, seed, and feed approach. That's how I'll call it, all right? Weeding means you need to be on something to kill that yeast. And you could do it either by a combination of nystatin and diflucan, or you could do it herbally. And I mentioned earlier tonight that product called Capri Plus, 2 pills twice a day. For really embedded yeast, sometimes you're going to need to be on these yeast killers for 2-3 months, maybe longer. Sometimes the diflucan, the azole type yeast killers do not work, especially if he's used it before and his yeast developed resistance, in which case the strongest way to knock those yeast down is to use a compounded anti-yeast medication called amphotericin B, all right? And you'll see that in my article here in a minute, okay? All right. So number 1, weed, okay? Seed, that means you got to be on good probiotics that are designed to repopulate the intestines. And I would want to choose one that also helps repair leaky gut that develops from having an imbalanced and healthy yeast, okay? Or healthy bacteria. So what I like using for that as part of my seeding approach is a product that is made by Pendulum called Metabolic Daily. And Metabolic Daily has in it Akkermansia, which is known as a keystone strain in our guts. It's a strain that normally lives there. And in addition, they pair this or combine this with 4 additional bacteria that are all known to be what are known as butyrate producers. All right, so butyrate, made by bacteria in your intestines, helps give chemicals to the cells that line your intestines so they can heal and stop leaking, okay? All right. And then Akkermansia sends out signals to all of the rest of the bacteria in the intestines to grow better, to be better, to behave better, to act better, to control yeast better, okay? All right. So I like using it for all those reasons. Good for leaky gut. Seems to be good at promoting healthy levels of good bacteria within the intestinal tracts too, all right? And I have people take it as 2 pills 1 time a day, okay? All right. All right. And then, hold on here just a minute. Oh, and then the other thing that I like to do is what am I doing here? Oh, the other thing I want to do is I want to feed those good bacteria. And feeding good bacteria involves feeding them prebiotic starches as well as polyphenols, all right? So Prebiotic starches are basically sugar starches, but they're the kind we don't digest and our yeast don't digest, all right? And so you can either do that by having a diet that's rich in plants, right? That's one way to do it. Or you can get a prebiotic. So for instance, I have a product in my store called by, who makes that one? It's called Mega Pre is the product. And it's made up of prebiotic fibers that the good bacteria in your intestines are going to use to grow, okay? The other thing that helps good bacteria to grow in the intestines is a group of chemicals called polyphenols. Now, polyphenols are found in colorful fruits and vegetables, coffee, olives. And so if you're getting, if he's got a heavy plant-based diet, he's probably getting enough prebiotics and enough polyphenols that he doesn't need to supplement it. But on the other hand, if he doesn't have a lot of plants in his diet, then he might want to get on a Mega Pre, 2 pills 1 time a day, and a polyphenol booster and by pendulum, and that would be 2 pills 1 time a day to help feed healthy bacteria levels, okay? So let me just do a quick screen share here for you. All right, so I want to show you the article I have on how to have a healthy gut microbiome. Actually, let's go. I'm going to show you 2 articles to take a look at, actually. So let's see here. Okay, yeah, they're both in the same place. So in terms of attacking yeast, read this article called Kills and Prevents Yeast. And it includes a lot of information about how do you heal your gut. My guide on how you heal your gut and keep promoting healthy levels of all germs in there is this one, Your Guide to a Healthy Intestinal Microbiome. In both of these, I talk about the weed, seed, and feed approach, okay? All right. And then in terms of those specific products that I was telling you about, let's see here. Stomach and intestines, where are you? Oh, we'll just go here. All right, so the yeast killer that's herbal, that's the Capri Plus there, okay? The Mega Pre, the prebiotic, is this product here. The Metabolic Daily, which is that Akkermansia with 4 other strains, probiotic, is here. And then the Polyphenol Booster is this product here, okay? All right. All right, now where am I here? Oh, there we are. Okay. All right, Amanda. Good luck to you. Good luck to your son, actually, too. So Tracy, you want to know what can you do to heal damage from oxidative stress? The one thing I would look at is, so you want to decrease the effect of the oxidation. But if you're trying to, all right, so there's 2 things. So if you're using high dose vitamin C or ozone, something like that, you do want oxidation. I mean, part of their way they kill germ, or in theory, they can kill like maybe viruses, or that they lead to better oxygenation of your mitochondria. That's one way they work too, is you do want some oxidation, okay? So you wouldn't want to do an antioxidant right away, but say the next day, work with liposomal glutathione. It's a very powerful antioxidant, as you know, and can help start repairing some of that injury, all right? Now, most of the injury, though, that you're going to get to your cells and your cell membranes is damage to the phospholipid fats that make up the cell membrane, and the phospholipid fats that make up your mitochondria membranes as well, too. And so you can replace that. You want to do phospholipid repair. And the product that has all those phospholipids in it is the ATP 360 product by Research Nutritionals. It's a phospholipid mix. I think there's like a variety of 5 different phospholipids in there. In addition, it has a number of micronutrients in it that will help your mitochondria run better too. But if I'm trying to do phospholipid repair, and especially in somebody that's ongoingly being exposed to oxidation agents, I would consider doing an ATP 360 3 pills 1 time a day. Okay. All right. Good luck, Tracy. Oh, that ATP 360 is one of the Research Nutritionals products as well, too. Let's see here. Hello, Mary. Let's see. Hi, Dr. Ross. I hope you're doing well with your move. It's coming along. I'll be glad when I'm no longer living in a cave without furniture, though. But yes, it is happening. And I did. I finally signed my clinic lease on Friday. That's right. We haven't been here before. I just signed the clinic lease on Friday. And so now I'm trying to put it together and get supplies in here, et cetera. But yes, thank you. Let's see. I am considering increasing to 300 milligram once a week to see if I hurts. Oh, let me start over again. I hope you're doing well. Let's see. I've been on tafenoquine 200 milligram for 20 months. I'm considering increasing to 300 milligram once a week to see if hurts. I stopped atovaquone a few months ago because I'm taking rifampin. Should I add back the atovaquone if I increase to 300 milligrams? So, I would consider, so if you're not making progress on your Babesia, I do think going up to 300 milligrams once a week, 1 time a day, once a week is a good idea, okay? I do like combining the tafenoquine with an atovaquone. I think it makes it a stronger regimen. And so I would go back even if you increase the tafenoquine. In terms of the rifampin and atovaquone interaction, I just want to say I use the two together. It's just you need to be aware that there may be a little variation in the effectiveness of both of them. So what happens is when you're on rifampin, it decreases, it turns on metabolism of atovaquone in the liver. So you get a decrease or you get an increased cleaning out of atovaquone. So you may have a little slightly lower blood levels than you might if you weren't on rifampin. And it makes it so the rifampin may be a little bit increased drug levels, all right? Now, for most people, this doesn't matter. Most people, you can take both together. I want to be clear about that, okay? And I have used both together before. But yeah, I think if you want to have a stronger Babesia treatment, I would use the combination of the tafenoquine with the atovaquone, okay? All right. Good luck to you, Mary. All right, everyone, that's it. So I've had a good time being with you here tonight. Y'all get to see, I'll probably start doing the webinars from here for the most part. And over the next few weeks, I hope you'll start seeing a transformation as I get more things in here. So yeah, anyhow, so keep an eye out on your email tomorrow morning. You'll get an email from me saying that the recording is ready to see. It'll contain a synopsis as well too. Next week, we'll be back at this again, and the start time is 4 p.m. Seattle time. I'm sorry, everyone, for the confusion around a 2 p.m. start time that the system showed you today. I have corrected that. And yeah, all right, good luck, everyone. Nice seeing you tonight. I hope to see you again next week. Bye-bye.